no one should die with the indignity of putting their teeth in a glass. And it's been my single greatest motivation, because I don't ever want to reach into my mouth and take anything out. It's not the physical act, it's not the device, it's how I feel about me.
Like with grandchildren, they don't know that I've got false teeth.
And you never want them to either, do you?
I mean, it's only lately that Bethany's found out, and my children don't know. I just don't want to see me with no teeth.
So you're telling me that you just come through an operation and your first panic was, if anyone comes to visit me, I don't want them to see me without false teeth, when actually what you should have been focusing on is just getting better. The majority of society doesn't understand the pain that you guys go through, the amount of additional stress that lingers in silence, thinking about things that people take for granted. But for you, it's huge. Hi, everyone. Today I'm here with Jackie.
Hello.
And Jackie's here for a clinical assessment, first time.
Yeah.
I can tell you're nervous.
Yeah, I am.
Okay, so let's start with, tell me why you're nervous.
What's going to happen and everything.
Okay, so I'll run through it with you. We're a digital clinic. So unlike maybe in the past when they were making your dentures or whatever, you know, when they took gungy molds of, we don't do any of that. So we just take one big scan that goes around your head. We take a face scan from the outside of your face to capture a 3D photograph of you. And then inside the mouth, we've got something that's shaped like a pen and is about that wide, and it just scans what you have left.
Yeah.
That's it. We need those three things. So the CT scan allows us to look in your jawbone to make sure, A, what we've got left, B, make sure there's no dodgy pathology in there of any kind at all. And it gives us a pretty good idea as to what we can and can't work with and what we can achieve. So we can only work with what you have left.
Yeah.
We can't work in thin air, right? The face scan shows us how things are going to line up against your facial muscles when I've finished. So all you're going to be interested in is smiling, chewing, talking, all that kind of stuff. But you're going to have to learn it all again. Because, as you said to me downstairs, you've been sort of speaking like that and not wearing your lower denture and all. You're going to have to unlearn stuff you should never have learned in the first place, and that's going to take time. So the face scan allows me to get an idea of where everything's going to be in relation to the rest of your face. So for me, and for all of us, it needs to look like it belongs on your face.
Yeah.
So the only compliment I want my patients to hear is, "Oh, don't you look well?" I never want to hear them go, "You've had your teeth done." You know what I mean?
Yeah.
It's got to look like you at the end of it. So that's part of what the face scan's for. The intraoral scan is a detailed scan of the gum tissue and the remaining teeth, so we can, A, look for any kind of pathology that we can't see with the naked eye. So we are looking for things like signs of oral cancer. It's incredibly rare, but it is a killer, which means it's the most important part of any checkup. This is the main thing we're looking for at annual maintenance when people come in every 12 months.
Yeah.
I think people forget that. I think they just think we're just having a general look. No, we're looking for oral cancer. That's the killer, right? It might be really, really, really rare, but it can happen. And we need to be sure it doesn't happen. And we have that data set, and we use that data set, if you need what we do, to plan everything. So none of it's invasive. It's just a load of people buzzing about taking data. So I hope that's cleared it up for you.
Yeah.
Feel a bit better now?
Yeah.
Okay, good. And what I would like to talk about today with you is, you wear dentures, correct?
Yeah.
So you've got some of your own teeth left.
Yeah.
You wear partial dentures.
Yeah.
When did that start?
Well, I've had the top ones quite a few years, but as slowly, my bottom teeth, To be honest, my grandson's dog knocked one of my teeth out. It jumped up with the muzzle on
Whoa.
and knocked it out.
Wow, okay.
And then slowly they've just all started going loose and coming out. Mm.
You know, one of the things is I think people misunderstand tooth loss, particularly as we get older.
Yeah.
It's along the same lines as people needing a hip replacement. We are the longest living human beings in the history of mankind. We are seeing conditions today in people as they age that has never been seen before, because everyone had the decency to be dead by the time they were 50, 200 years ago. Do you know what I mean? They just
Yeah.
didn't hang around.
No.
Okay? But now everyone hangs around until they're 85 and they want to go salsa dancing every week.
Yeah.
You know, they're just not satisfied with being on. There's nothing wrong with that. But our genetics isn't programmed to run all our body parts for 85 years for everybody.
Yeah.
Which means some people need their hips replacing, other people need their knees replacing, some people need their teeth replacing.
Yeah.
It's just the way it is. You know, we're not sitting around here going, oh, you should have brushed them more. That's not really the biggest thing. It might have been a thing, but it's not the biggest thing. The biggest thing is we're not dying. We're just hanging around forever. Yeah. You know, that's the biggest thing. That's why hip replacements have increased, even though the quality of medical care has increased. Hip replacements have increased because we're all living for longer. So people beating themselves up over, oh, should have taken better care of them when I was young. I hear this all the time. I'm like, mate, you're supposed to do mad things when you're in your 20s. That's normal. Okay? No one in their 20s thinks they're going to need a hip replacement when they're 55 or 60. No one does that. No one's ever going to do that. When you're in your 20s, you just go, I am invincible.
Yeah.
I'm going out 3 days and 3 nights in a row. I'm going to drink 20 cans of Coke and I'm going to eat crap. That's just what it means to be in your 20s. But no one's thinking about, oh, well, you know, if I don't take care of this now, it's a definite hip replacement when I'm 62. Yeah, no one thinks that, okay? But instead of doing the blame game, let's do the, okay, well, we are where we're at. Let's just try and solve it kind of thing, that approach. So you said this started years ago. Top Denture was the one that went in first.
Yeah.
Tell me about the day they fitted that and how you felt.
I felt as though I'd let myself down.
Why'd you blame yourself?
As though I'd not looked after them.
See? It's exactly what I'm talking about, this. One thing I notice with a lot of patients when I speak to them, I don't know where it comes from, but they all seem to have a lot of self-loathing, and it just seems to linger. Oh, it's my fault. How'd you know?
I just feel like I mustn't have cleaned them proper and done what I should have done.
Okay, but with that level of self-blame and now this plastic monstrosity in your mouth.
It's not nice. It's
right.
not.
And at which moment did that thing start changing little bits of your behavior?
This last few years, it's just like with grandchildren. They don't know that I've got false teeth.
And you never want them to either,
No.
do you? I hear this so much, and it's like triggers.
I mean, it's only lately that Bethany's found out.
So your own...
And my children don't know.
Why is it so important to you?
I just don't want to see me with no teeth.
They won't love you any less.
Oh, no. Oh,
But it's you. You've decided this.
because Andrea downstairs, when she was doing the training, she worked in an old people's home, and she said the worst thing I had to do was mess with false teeth. So So she didn't know that I had false teeth.
See, my hero professionally is a guy called Professor Brannemark. Professor Brannemark is the guy, he was an orthopedic surgeon who discovered that we could use titanium rods that we call dental implants in the mouth so we could fix teeth so people didn't have the indignity of having to take them out. So he had a very famous quote, and it moved me the first time I heard it, the first time I interacted with his people. He said, no one should die with the indignity of putting their teeth in a glass. And it's been my single greatest motivation since I did my first one in 1999. Because I don't want to die with my teeth in a glass.
Mm-hmm.
I don't ever want to reach into my mouth and take anything out, because it's not the physical act, it's not the device, it's how I feel about me. And look at the fact that you've got something in your life that you think about that's important that you would never have had you just had fixed teeth.
Yeah.
You'd never have had the thought. You'd never have modified your own behaviors because of all these other people that you think you're going to let down by letting them know you've got false teeth.
Like I had operation, and you have to take your teeth out when I couldn't wait, get them back in, then nobody'd see me without them.
So I mean, I shouldn't laugh, but it's the ridiculousness of how it made you feel that's bothering me. So you're telling me that you just come through an operation and your first panic was, if anyone comes to visit me, I don't want them
Yeah.
to see me without false teeth, when actually what you should have been focusing on is just getting better. People ask me why I do this job. This is why I do this job. Because, I'm lucky. I always tell myself I'm lucky because I deal with it every day. We can stop if you like. I don't want to upset you.
No, I feel soft crying, but it's just...
I don't want to put you through this if it's going to upset you, but I know how this resonates with a lot of people that are watching, because they all have their stories, every single one of them, just like you. It's this that has to stop. We live in an age where we can do almost anything if it's medically safe to do so. But if it is medically safe to do so, I don't want my children to hear this in the next generation, ever. I want it to become nostalgic, where people 60 years from now sit around going, do you remember when people had to wear dentures?
Yeah.
That's what I want. I can't help it. I've got nothing better to do with my life. I don't know what. It's just a great motivator for me. But it's this level of upset that, and I think that's the worst bit. The majority of society doesn't understand the pain that you guys go through, the amount of additional stress that lingers in silence inside all of you all the time, thinking about things that people take for granted. But for you, it's huge. After surgery, coming round from surgery, the first thought is, I don't want to see my loved ones if I can't get these teeth back in. Wow. That's the bit that really, really bothers me. Because I just think it's not right. Do you understand the process you're about to get into?
Yeah.
Yeah? And is it making you feel scared but excited, but both at the same time?
Yeah. Yeah.
Bit like queuing for a roller coaster, right?
Yeah. I've never been on one of them. I've been on a big wheel and I got stuck at top and never again.
Yeah, we're not going to get stuck at the top on this one. No. We'll go all the way around and get you back out safe. Don't worry about that. This is the bit for me that's my motivation. It's the bit that Bethany is motivated by, as she was so eloquently telling me. So we had a staff party on Saturday, and all she could talk about was you, which I get.
I love her to bits.
You are so important to her, and she just wants you to be happy, and she wants to help make you happy.
Yeah.
And she started, like you, getting teary about it. I said, why are you crying, girl? We're talking about good stuff here. We're talking about doing something good here. And she goes to me, I want this for her. And I said, I know you do. Of course you do. And I'm going to meet her. And I want to know that she wants it for herself. Because that's the most important person in all of this, okay? That's a biggie. And I also want to guide her through the journey. I want her to have the life she's imagining, a new reality.
It's just that I'll be able to eat proper food instead of just eating cereal all the time.
One of the subjects I talk about is the importance of good nutrition as we age. People need to know the facts about why we have teeth in the first place. I said this on one of the other podcasts. Long before we could speak, we had teeth. Long before we had selfies, we had teeth. And the reason that nature put them there is because if you can't chew your food properly, you won't get the nutrition that your body absolutely needs. So you end up eating things that are softer, which generally have higher calories, and that's not good for your body. Or you don't chew your food as well, which means it goes down here and it gets here, and the body produces more acid to break it down. That acid either comes back this way, which causes heartburn, or it goes that way, and it buggers up your digestive tract. And then I see people on all kinds of drugs. Omeprazole, this, that, the other. Oh, I've got something wrong with my guts. I've got something wrong, heartburn, blah. When all the time, all it was the blender wasn't working properly.
Yeah.
Fix the bloody blender, and
It's
everything's
true.
fine again. Because that's how we're built. So no, it's not okay to walk around with half your teeth missing. It's not all right. It might be enough for the show, but that's not what they're for. They're for chewing food. And there's a minimum number of units in a particular kind of alignment that is required to do the chewing. And chewing isn't just your teeth. You've got tongue and you've got cheek. So what happens is, imagine the tongue and the cheek pushing the food in between the teeth, and the teeth is pulverizing it. You take any one of these three away, you ain't chewing anything. So the last time I checked, everyone I treat has got their tongue, they've got their cheeks, they just haven't got the teeth.
Mm-hmm.
That's the thing we put back. So the reason we do it is because we want to eliminate disease. So we know something about dentures. Everybody in my profession knows this about dentures. Dentures destroy bone. I can't think of another medical device that we make in any other part of the body where we put it in knowing that it's going to bugger everything else up.
Mm-hmm.
I know why we have dentures. I know why we had them in the first place, because we didn't have this technology today. And I know everyone keeps going on about, oh, it costs a lot more than dentures. Well, I'd say that having a hip replacement costs a hell of a lot more than dragging yourself along the ground. Why doesn't everybody just do that then, if cost is the only thing we're going to pay attention to? I didn't make the rules. I'm a clinician. My job is to tell you the purpose behind what we do in the order that relates to clinical medicine. And the number one reason is to get you to chew your food properly. If that box isn't ticked, I'm not talking about anything else. The number two reason, well, actually, it's the other way around. So the number two reason is to chew your food properly. But before that, I need this mouth to be disease-free. Now, we know something about dentures. Dentures are so food retentive, so plaque generative than any other device that we could possibly put in someone's mouth. So not only is it buggering up the bone that it's sitting on, but it's probably buggering up the teeth that it's working around as well. Notice something. Dentures never get smaller. They only ever get bigger. So you lose more teeth and your denture gets bigger. What never happens is you gain more teeth and your denture gets smaller. That never happens.
Yeah.
So we know it's on a hiding to nothing. Yes, I've heard all the, and I call them, I'm a realist. I live on Earth. I know that we charge £16,995 to do this. That is what it costs in this country to do it at what I consider to be excellent value for the quality of what you're getting. I didn't make the rules to exclude it from any other systems like the NHS. I didn't make those rules. And no, I'm not wasting my time having the fight. I've just got a solution to a big problem. And this needs to be paid for, and that's what it's all about. But the way I ask people to look at it is the value. So I made a podcast with my mum. So my mum had all her teeth removed in 1982 when she was in her early 40s. In 1985, it was all put back. I think my dad paid $100,000 in 1985 to get that done for my mum. And it was so important for him to not lose his wife. And he was lucky. We're not rich people. It was a struggle for him, but he could just about get there. And he said to me till his dying day, it's the greatest investment I ever made. It's an even greater investment than the investment I made in my children's education, was to make sure that my wife didn't become a shell of a human being. Mm-hmm. That woman raised me. So I get why he thinks that's the greatest investment. Now, that has lasted for her till today, 40 years. That is, if you want to break it down, $2,500 a year for 40 years. Per day, that's working out to like, I don't know, 70 quid, 7 quid. I don't know. I can't do it. 7, 8 quid a day, right? But we know something. These are some of the longest lasting, if done properly, medical procedures that we actually have. So I say to people, look at it as you investing in you. And it's, you either feel the value to you or you don't feel the value to you. But look at the benefit of you being the real you on the other side, where you're not worried about people seeing you with no teeth, because you can't take your teeth out. They're fixed. No one's supposed to take their teeth out. It's supposed to be fixed. That's what you call teeth. Our prosthetics mimic that. So I'm hoping that through this journey, no matter what your decision is, if nothing else, we've given you hope that the reality of correction exists right now. Did you even know this kind of stuff could be done?
Not till Bethany started here.
Not till she started working here did you know.
I knew they did implants, but nothing like you do.
Nothing like this. Mm. It's a bit of an unfair comparison because there's two kinds of implants. The first kind, I expect every dentist to do today because all the technology exists to do it, which is like, okay, I've got most of my teeth. I'm missing 2 teeth over here. Right, I'll put an implant in. Straightforward, right? Second kind of implants is the world I live in, which is what we call total oral rehabilitation. These are the people with the highest need. They are facing a life with no teeth, or they're living a life with no teeth right now. It's coming. We can see it. Just to be able to bypass, and within 2 or 3 hours, just get them to a new reality, that technology has been possible. the ability to be able to make that switch has been possible for 26 years, because I know, because I've been doing it for that long. The speed at which we can do it today and the accuracy to which we can do it today, you can't compare to what I was doing 26 years ago. I can't compare it to what I was doing 6 years ago, let alone 26 years ago. That's how far we've come. And because it's becoming more and more and more and more technology-driven and accessible, I'm hoping that 50 years from now, people talk about dentures like, do you remember when people had dentures?
Yeah.
Because no one has them ever again. So I'm wishing you all the best on your journey, no matter what happens. We go get the scans done, right? And maybe if you're up for this, and if we're going to do this and you're suitable and all that stuff, maybe we'll have an interview on the other side. And then you can tell me what the world's like then. And we'll take it from there.
Yeah.
Is that okay?
Yeah.
Thank you so much, Jackie. I really appreciate it.